live streaming. Good evening, everyone. I'm Dr. Hita Patel from IIP Digital Media Team. I'll be host for the today's webinar on virtual series with a resource person of being Dr. Dhruv Dave sir and Alpa ma'am, which is being organized by a joint IIP Research Committee and IIP Women's Cell Kheda district. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IIP Digital Media Team consists of group of physios who handle Zoom platform, webinar live streaming, and IIP profile on social media platforms, Facebook, Instagram, and Twitter, LinkedIn, and YouTube. Follow the IIP profiles on this social media to receive the notification of our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IIP YouTube channel for the notification of our live webinars. In the playlist section of this channel, webinars are segregated into various folders on the topic like orthopedics, neurology, sports and fitness, pediatric, cardiopulmonary, women's health, research, cancer rehab, and many more. The social media link will be shared in chat shortly. I'd like to invite Grishma Shah Madam, Kheda District Sub Coordinator, to overview for the session.
Thank you, Heta ma'am. Taking forward, good evening everyone, respected dignitaries, esteemed speakers, faculty members, researchers, clinicians and all our participants. It is my privilege to welcome you all to the virtual research series organized by IAP Research Committee in collaboration with IAP WC Kheda team, consisted of Heta ma'am, along with me Dr. Shipra Shah ma'am and Dr. Krishna Vyas ma'am. This academic initiative has been designed with the objective of strengthening research capacity and promoting evidence-based practice among physiotherapy students, academicians, and clinicians. This series will be conducted from 30th March to 4th April from 7 to 8 p.m. and will cover important aspects of research, including introduction to research in physiotherapy, types of literature review, research problem, research question, and research design, sampling and data collection methods, research ethics, and finally research proposal writing. We are truly delighted to see such enthusiastic participation, which clearly reflects the growing commitment within our profession towards research and academic excellence. This series has been organized under the guidance of distinguished leaders, including Dr. Sanjeev Jha sir, Dr. Ruchi Vashne ma'am, Dr. Nehal Shah ma'am, Dr. Pooja Kamble ma'am, and Dr. Jaspreet Kaur ma'am. It is now my honor to invite one of our mentors, Dr. Nehal Shah ma'am, to address the gathering. Dr. Nehal Shah ma'am is the Vice Chair of AWP World Physiotherapy. She is Principal of SBB College of Physiotherapy, Ahmedabad, and a member of CEC Council of IAP. She is also a respected academician and leader who has contributed immensely to physiotherapy, education, and research. We welcome you, ma'am. We request you to kindly share your words with the audience.
Good evening, everyone. And it's nice to see this kind of a gathering, especially for research. You know, when people consider research as a boring subject, and still mushrooming of researches is happening. So the only aim of arranging this kind of a webinar was to just give a brief outline about research so that the participants do not, whosoever attends at least comes to get a gist of what is research. They don't, do it haphazardly, don't do something wrong, because what is needed, see, I am heading the research committee by IAP, and so my goal is to promote good quality research. And out of my experience, what I have seen is the researches coming out of India are really at times of a very poor quality, and that is why our data is neither seen nor heard nor recognized. And so our aim is to get research of India at the global level. Now, something about IAP Research Committee. So IAP has formed research committee, and I'm heading this committee since 2020. wherein we are the main thing that we are doing is we are funding researches. We have been funding good quality researches, and there is a strict peer review process. There is strict auditing that is happening, and after that we are dispersing the funds. Every alternate year we are announcing this funding. Right now also one the first proposal that was funded by IAP research committee has is on the verge of completion, and we may just look at that research during our Asia West Pacific conference. So I am here again telling everybody that look at what is happening at IAP, look at what is happening at IAP research committee, and we are announcing the grants. Keep watching for our social media platforms to know when we are announcing the grants. We follow the deadlines, and then we disburse funds. Uh, we disburse funds on depending on the merits. No, we are not funding any research to. I mean, doing funding for people staying out of India. We are doing it for Indian physiotherapists only. There was a question, I guess, in the chat box whether the funding is happening outside India or not. We are funding this research only for Indian physiotherapists. Uh, we will be this time we had not announced the short term student funding, but it is still under consideration that next time when we announce, we may announce student funding as well. But right now we are announcing it at a junior professional and a senior professional level. And so the aim is, and now research committee will keep on coming with all these kind of activities that are promoting research, that are giving you the gist of the research. And thank you very much once again, everybody, for trusting us and attending this in a huge number. Thank you.
Thank you, ma'am. Thank you for sharing such an inspiring words and leading us towards the meaningful research. May I now request Dr. Jaspreet Kaur, ma'am, the State Head, Gujarat IAPWC State Head and Principal of KD Institute of Physiotherapy. Ma'am has been actively involved in strengthening professional activities and academic initiatives within the physiotherapy community. We request Dr. Jaspreet, ma'am, to kindly address the gathering.
Thank you, Garishma. A very good evening to all. Good evening, Nehal ma'am, Alpa ma'am, Dhruv sir, Shraddha ma'am, I can see, Gopi, Shipra, Garishma, and Heta. It's a pleasure, and I'm very proud that my Kheda district team has took up this initiative to spread the awareness around the corner more for IAP and plus the research initiatives which have been taken. And we're very much thankful to Nehal ma'am also for supporting us and making it an active activity. The main purpose is so that at least the professionals, like ma'am said, we are looking forward towards better research in India. And since so many we ma'am and me have done a lot of conferences together, and the quality of papers we see, sometimes we really feel disheartened. And looking into this aspect, we want to strengthen our fraternity and our budding physios for this. So thank you, Team Kheda, for taking up the initiative. Thank you, Team IAPWC. And I'm really thankful to all the speakers who will be giving their time and sharing their expertise and inputs with us. So thank you so much.
Thank you, ma'am, for always guiding us and supporting us. So starting today's session, it is now my pleasure to introduce the moderator of today's session, Dr. Shipra Shah, ma'am. She is an assistant professor at Ashok and Rita Patel Institute of Physiotherapy. She specializes in musculoskeletal physiotherapy with over 14 years of academic and clinical experience. We are delighted to have her moderate today's session. Dr. Shipra ma'am, I now request you to take over the session and make us aware about the speakers of today.
Thank you so much, Grishma ma'am. Thank you again. First of all, good evening to everyone and welcome to day one of our virtual research series. Today's session is actually titled Introduction to Research in Physiotherapy. But I want to make it, this is very clear at the outset that this is not going to be just as a basic introduction what we are going to discuss today. So we are here to question how we think, how we practice, how we, whether we do clinically actually stands up to the scientific quality. To help this unpack, we have here two experienced academicians, Dr. Dhruv Dave and Dr. Alpa Purohit. Let me introduce Dr. Alpa ma'am. She holds an MPT in orthopedics and a PhD and is currently serving as a principal of AIMS Physiotherapy College, Ahmedabad. With over 18 years of experience, teaching experience, and 15 years as a postgraduate guide, she brings strong academic depth. She has presented and published multiple research papers at national and international platforms, delivered several expert talks, and has been recognized at various conferences. She's also actively contributing at the professional level as a state sub-coordinator in IAPWC. Joining us as well, Dr. Dhruv sir, Dr. Dhruv Dave. Sir is PhD in physiotherapy, currently serving as a principal at Ashok and Rita Patel Institute of Physiotherapy, Charu sir. With extensive academic and administrative experience, he has also served as Dean in charge of Faculty of Medical Sciences. His work strongly reflects community engagement, having organized hundreds of physiotherapy camps and contributed significantly to rehabilitation awareness. He has guided multiple research scholars and has actively presented work at national and international platforms. Thank you, ma'am. Thank you, sir, for joining us today and being part for this discussion. Okay, before we begin today's session, I just wanted to briefly state that purpose behind this research series. In physiotherapy, we often see a gap between what we practice and what we scientifically validate. So many students and clinicians are exposed to research, but not trained to think like researcher. This series is designed to address the gap, to build the clarity, strength, and research thinking and help to translate clinical observations into meaningful evidence-based work. With that intent, let me begin today's session. Let me share the slides first. I hope, is it visible? Yes, sir. Okay, so Dhruv sir, we often tell students that research is important, but that statement has become routine. Now everyone is saying research is important, it's important. So from clinicians' standpoint, not as a textbook definition, what does research in physiotherapy actually mean? And more importantly, if I say, why should a busy clinician are about it all? Because many still believe that good clinical practice is enough.
Yes, good evening, ma'am. On the outset of initiation of research series from IAPWC Kheda branch and from IAPWC Gujarat chapter, I would like to thank all the office bearers of IFE to start this particular process in regards to enlightening all of us for the research program. Now, coming to the point as what Madam has asked, that what is research from not just theoretical point of view, but in context to the clinician, as the motto of IAP is that eventually down the line, whatsoever we are doing are in a position to help the person who are working at various clinics, and ultimately to help the person who is living in community to get benefited from physiotherapy by either preventive, promotive, curative or rehabilitative role of physiotherapy. So research, as the slide says, is a series of systematic investigations which are necessary for the study of methodology aspect, for testing various techniques which we have learned or are about to come so far as concerned with physiotherapy, and various outcome measures which are available globally. We need to testify it in regards to the physiotherapy practice. Now, for what? For, as what one I have said, is in context to improve the care of the patient, how much the effective the treatment is, rather than the guesswork, the systematic and the scientific basis for the research which is what is being done, and expanding the knowledge for the particular field, may it be from woman's health when the baby is in the mother's womb to that of the last breath of the individual. So from womb to tomb, it is very much necessary to expand our knowledge and ultimately contribute to the society. And for the same reason, the research is very much necessary, right? And for the clinician, next please, ma'am. For the clinician, why is it necessary is it is going ultimately to support what is as part of evidence based practice. It improves patients outcomes, so we are in a position to come to know that patients were here when they have joined us, to ultimately they have moved up with various outcome measures. To keep our knowledge up to date whatsoever the advancement that is happening so far as concerned with the field of physiotherapy, field of healthcare, may it be digital health, may it be mental health, may it be the various advancement in technologies and innovations, helping and enhancing our clinical decisions so that we are able to help our patient client populations to improvise their not just quantity but quality of life, uh, ultimately improvising and increasing the professional credibility, as what Nehal madam was mentioning it about, that when we are talking about research, it is very much important that how world is looking at India, and I'm very sure when we as an IAP going to organize Asia West Pacific conference, people have very high hopes so far as concerned with the research, which is what is happening not only in Southeast Asia but India in particular. It also helps in specialized care and ultimately improvising and encourages all of us to think critically. It is not just about to criticize, but critically appraise all of us. And for that reasons, we as clinicians are necessary and in need of doing research. Yes, ma'am.
So that, thank you. And this gives a strong base to move forward. And building on that, ma'am, I would like to ask here that we see students full of ideas in the beginning, but somewhere between the ideation and execution, everything like collapses. So in your experience, why is research such a gap between having a research idea and actually completing a study? Is it a lack of clarity or any kind of mentorship, or are we training them incorrectly from the start?
Thank you so much, ma'am. So first of all, I would like to thank IAP, entire IAP team, IAP research team, especially Nehal ma'am, our Gujarat state head, Jaspreet ma'am, IAP Kheda branch, and dear participants. Uh, First of all, I would like to address the why students are struggling with their initial part of the topic selection. So there are certain challenges in the topic selection. The overly ambitious idea. Initially, students often try to solve the massive problems rather than focusing on small and manageable gap. Sometimes what happens, the vague research questions. So it is difficult to plan the study and leading to unclear objectives, lack of theoretical framework. So students struggle to anchor their ideas in the existing literature. So second point, the methodological and practical issues, inappropriate research designs. Students have difficulty in selecting a right methodology, quantitative versus qualitative research questions, difficulty in creating a tools. Designing a tools like survey or questionnaires is often a major hurdle. Data collection issues, difficulty in finding a respondents or getting a permission from the institute is a frequent and major barrier. Next, ma'am. A third point is the personal and academic constraints. Inexperienced researcher, it will lead to anxiety and frustration in the initial part of the research, lack of interest. Sometimes what happens, somebody or some guide is interested in giving us some new research topic, but truly the students are not at all interested in that topic and the motivation vanish. Third is a unclear expectation and time and resource constraint. The dense curriculum, financial limitations sometimes, and lack of specialized software and equipment impede the progress. I would like to give an example. Whenever the students comes to us, like in the initial part of the topic selection, they say that I want to study how the social media affects the mental health, or I want to do study on a factory workers. So what are the challenges at that time? You know, the social media is a wide term. So which type of the social media they want to assess, like Facebook, Insta, Twitter, any kind of social media or all type of social media. And the second term is a mental health. It is also ambiguous and no clear population and time frame was defined in this title. So what is the actionable study design? Instead of giving, I want to do study how the social media affects the mental health, the effect of Instagram usage frequency on specific mental health, that parameter, that is the anxiety levels amongst 18 to 20 years old at a specific university or Gujarat University, whatever the university, or specific population like physiotherapy population over a 4 week period. So use the specific platform, metric, population, and the time. So this way we will help the student and why the students are struggling in the initial part of the research. Thank you, ma'am.
Thank you,
Ma'am,
ma'am.
can I add something?
Yes, yes, sir.
Yeah, along with that, one of the very important aspect which I also feel it that which I have learned from my mentor is money hai to honey hai. I mean by that, if monetary aspect is going to be there along with the research, the kind of opportunity in context to funding availability, in context to the job availability as a researcher, and likewise, then people will ultimately try to do a sort of research. And there I would love and like to applaud the forum like IAP, which are trying to come up and start funding maybe mini and micro research projects. And likewise, similarly, I know many of the universities and many of the government as well as the non-government funding agencies which are contributing in context to the research. So if those sort of opportunities are available with science, with engineering and technology, if similar way, if it is going to be available, definitely people will change their mindset in context to doing research in physiotherapy.
Thank you, sir. Thank you, ma'am. I hope the audience is noticing how we should not assume things like without asking questions. Sir, over to you. Like we practitioners actually rely on observations. Like I have seen in my case also, with my patients also. But the researchers demands structure, controls, and the objectivity. So where exactly do we draw this? Like my question is here, how is the research thinking fundamentally different from day to day clinical decision making? And do you think so that clinicians sometimes overestimate their observational studies or accuracies?
Thank you very much, ma'am. This is in regards to if I can correlate my answer with the structure of this research series program. And it suggested that if one need to do a sort of research and comparing it with a sort of clinical decisions, so one need to know about a sort of purpose for the particular research, which is going to testify any sort of new ideas, new treatment strategies, or new theories which are ultimately coming out, compared to a sort of clinical decision. As a clinician is a sort of specific patient, specific problem, and specific solutions. If I'm talking in context to research from a researcher perspective, it is going to be a systematic, structured, and a strict protocol which is being designed and followed, while in context to clinical decision making, uh, uh, all the patients with diabetes are not same, likewise low back pain are not same, likewise stroke are not same. So one need to be flexible, and one need to be very much oriented to the patient, what their demands are, and accordingly if they are going to plan, then the clinical decisions are going to be more of appropriate. In context to the scope, when we are targeting a sort of research, it is a group of people we are targeting, while as what I have mentioned, the clinical decision is going to be the individualized one. In context to the research, it is going to be a time consuming and a sort of long term cohort studies, and likewise, while for the patient population, it is very much necessary that it will depend on the particular patient, and immediate or short term results are necessary, otherwise we may lose our clients. The decision is based on the data which are available up there in various researches, various randomized control trials, systematic studies, and likewise, and all depend on the statistics. While for the clinical decision, it is what the patient first, patient preferences, and the experience which the particular therapist has for the particular condition, for the particular treatment, and accordingly the clinical decision comes. Along with that, the environment is going to be completely controlled, completely ideal in context to the research, while in context to the clinical decision, it's going to be a sort of real world scenario, and many variables are happen. This is specifically happening in context to the resource limited countries like India. And again, in India, if we are working in rural areas, the resources are really very limited, and within those limited resources, one need to understand the context and give the application in context to the clinical decision. So that is how the research from an ideal condition is different from that of the day to day, the clinician who is going to have their clinical decision making, ma'am.
Okay, so if I summarize this correctly, research is not just replacing clinical practice, instead it's refining the clinical practice, right, sir?
Exactly,
Okay.
ma'am.
Thank you. Moving forward to Alpa ma'am. Ma'am, like that brings me to a concern we see very often. A lot of studies nowadays are methodologically sounded, but clinically irrelevant. So how do you ensure that our research actually answers the real clinical issues or problems rather than just fulfilling academic requirement or the publications?
Thank you, ma'am. Always ensure that research is clinically relevant rather than purely academic. So let's understand what is academic research. The primary goal for the academic research is to gain the knowledge and the question source from the literature gap and curiosity. While we are doing the clinically relevant research, so improve patients' outcome, that is our primary goal. and to change the practice scenario. And the question sources are always from the clinical problems and patients or clinician inputs. Like some patients always comes in a clinic, like patient comes in our OPD since last 20 days, and patient is taking the ultrasound for that specific tender point, but there is no change in the pain. So at that time, in the clinical relevant research, that thought will be arise that why this pain is not reducing even after giving a specific dosage of ultrasound. So this is the difference between the academic research and clinical relevant research. So for that, first of all, next ma'am, next slide please.
Is it?
Yes.
Yes, sir.
Yes. So for that, we have to engage the end users in the early stage of research, engage the patients and clinicians. So always involve patients, caregivers, and practitioners in the designing phase, not only just for the recruitment. Second is establish the advisory board. Create an advisory board comprising the clinician and patients to brainstorm the protocol, ensuring the study is practical and address well with the practical real world scenario. Second is to focus on the practice oriented questions. So always use the PCOT approach like population, intervention, comparator, outcome, and time frame to ensure focus and clarity and applicability. Define the smallest worthwhile effect. So before starting and determine the minimum improvement in the patients consider worthwhile rather than just seeking a statistical significance. Always see the clinical significance level also. Next, ma'am. Yeah. Ensure the evidence-based design. So conduct a systemic review first. So perform a systemic review before starting a new research project. One, to identify a genuine evidence gap and avoid a redundancy. So register the protocol. I would like to recommend the register the study protocol in the clinical trial.government to increase the transparency and reduce the reporting bias. And the next is focus on implementation and dissemination. So use a plain language. Like sometime what happened, we are using some fancy and good language by in our publication. So what happened after 5 years, when the clinician wants to study your article or review your article, it is difficult to understand and summarize that article. So always use the plain language, create a summarize and report in a lay language so that it's making the language accessible to the patient as well as busy practitioner in the future. Highlighting the so what means clearly articulate in the research findings why the study matters and how it applies to the clinical practice. So this way we have to differentiate the clinical implication of our that research study. Thank you so much, ma'am.
Okay, so in the sense I like issue is not lack of ideas here. It is lack of structured execution.
Yes.
Okay, thank you, ma'am. Moving forward to the Dhruv sir again. Again, coming with the student struggle that most at this stage, like framing the research question, that is a struggle part of the research. So in your view, what distinguishes a weak research question from a strong one in physiotherapy? And if you had a point, like one common mistake what our students are doing while framing questions, what would be that?
Very important one, ma'am. And when we were discussing, I was looking at the webinar chat, and then few of them had this sort of concern as well, that what should be my research question, how should I select my research topic, and which type of research, if I'm doing my PhD or master's or bachelor's, so on and so forth, and likewise. So in regards to the research question, what is going to be more appropriate? The strong one. So the research question need to be one of the very important aspect as a clinician, as a researcher, as an academician, as a student, as a faculty member, and likewise it need to be clear and specific, as what even my fellow counterpart Dr. Alpa has said, that if the interest is there in the particular field, and then if you are working in that field, then you will achieve much more so far as concerned with the particular field. Say for example, you have the interest so far as concerned with oncophysiotherapy, and then you are landing up with the issues for the cardiorespiratory would be very difficult, and so on and so forth, vice versa. So one need to be clear and specific. Along with that, she has mentioned about the P code format. Very, very, very important, that which patient population you want to target, what sort of intervention you want to use, what are going to be a sort of comparator, and what outcome measures. And when we are talking about outcome measures, it is very much necessary. Many a times I am listening to many of the research presentations that this is XYZ article which I consider as mother article, and they have said so and so, and that's the reason why I am taking ABC as part of the outcome measures. Now our question is going to be like that, whether that outcome measure is applicable in context to India, and if the answer is yes, then your outcome measure is appropriate. And she has also rightly mentioned is it need to be time bound, very much necessary. Otherwise it is going to be very difficult that for post graduation the research period available is about a year or half, and then when you are looking at the feasibility aspect, it would be very difficult so far as concerned with very heavy research question you have made. Along with that, whatsoever the outcome measures you are measuring should have minimal clinical detectable change, which is necessary. So it is not sounding just statistically significant or not, but whether the results which are being produced are clinically significant or not. Have they improvised the existing clinical practice or not is very much necessary, along with the ethical concerns about do no harm to the patients and adding some values to whatever the practice which is what is existing. If whatever is being existing and you are just replicating the kind of practice, so then that will not be that great way useful. So one need to be clear and specific as much as possible so far as concerned with the research, and that is how this particular issue is to be addressed.
So what we are seeing is the gap between the knowledge and the applications. That's why students are struggling. So with that perspective in place, let's move to the next dimension. So Alpa ma'am, here my question is like, often we see like like sir have explained the frame. Now after framing that frame also, we see we are students are like teach about the bias control and standardizations, but practically speaking, can bias ever be completely eliminated in physiotherapy research, especially when dealing with human subjects and therapist dependent interventions? Or is it just more about managing bias rather than removing it? Ma'am.
Okay. So, ma'am, first of all, bias cannot be completely eliminated in the physiotherapy research, as is the case in most areas of human subject research. However, it can be minimized, managed, and controlled to a high degree through rigorous research design and methodologies, because physiotherapy always relies heavily on a behavioral interventions and manual therapies. Blinding practitioners and patients is often difficult and leading to a persistent challenges in ensuring a complete objectivity. Next, ma'am. Yes. So challenges in blinding, unlike the drug trials where a placebo is easy to produce, while the physical intervention like exercise and massage are difficult to blind, patients often know if they are receiving the treatment, which can introduce the performance and detection bias. Second is individualized nature of treatment. So how the different therapists apply the treatment, like different technique, pressure and style, it also makes the performance bias hard to eliminate. And next is subjective outcome measures. Many physiotherapy outcomes are reported by the patient, like pain outcomes, quality of life outcomes, which are inherently subjective and susceptible to reporting bias. Attrition and dropouts. Participants frequently drop out from the study, especially when they know they are in a control group and not seeing any result. Next slide, please. So there are methods to mitigate and control the bias. First is rigorous randomization and cancelment. Allocation, concealment reduce the selection bias. Second is independent outcome research assessor. So blinding the person measuring the patient's result from knowing which treatment the patient received, that is a detection bias. Intention to treat analysis, the analyzing the participants based on the group they were originally assigned and regardless of whether they have been dropped out or adhere to that particular protocol or particular group. Next is a pre-registration trial, registering study protocol in database, that is a clinical trial, always before starting the study. And next is a standardized protocol, using strictly defined procedures for assessment and intervention, ensure the consistency across the different clinicians. So I would like to give an example. Next slide, please, ma'am. So that is a performance bias. I would like to give a one case scenario where the researcher believes that the active exercise, that is the group A, are superior to education only, that is group B, for chronic low back pain. So what is coming bias? So the physiotherapist delivering the treatment might show more enthusiasm and encouragement during the exercise session, that is group A, than during the education only session, that is group B. So what are the outcome will come? The patient in a group A might show more improvement simply because the higher motivation and higher engagement of the therapist and patient both, not necessary because of that exercise itself. So this way we are just understanding why the performance bias coming during our study. So at that time we have to eliminate and see some certain steps to mitigate that bias or control that bias. So we cannot completely remove the bias during our physiotherapy study, but we can control and minimize that bias by performing a certain methodological steps. Thank you, ma'am.
Okay, thank you, ma'am.
Yes, just can I add something?
Yes, sir. Yes, sir. Please.
Yeah. So exactly what Dr. Alpa mean by is if we are, if in a case able to blind the assessor, so that is what she has mentioned in this scenario, that I like group A very much. But if the one who is measuring the outcomes are blinded, so they don't know that whether they are from the patient who is from group A or group B will not be in a position to over or under assess the particular outcome measure. Simultaneously, the one who delivers therapy, if we are in a position even to blind them, so that we are in a position to not to come to know that whether they are from the experimental group or control group, will ultimately able to minimize the bias as much as possible. And there madam has rightly said that we are in a position to minimize the stuff as much as possible.
The question is not, do we have bias? The question is, which are us, right? And if you torture the data for long enough, so it will confess to do any kind of manipulation here. Anyways, this creates a nice transition to the next point. So, sir, I would like to present one more question here. Like, students get overwhelmed when they hear RCT, cohort, cross-sectional, qualitative. These are the names of the study designs. So, from a practical point of view or practical lens, I say, how should one choose the most appropriate research design for a clinical problem? Or is there a decision-making hierarchy you personally follow?
Yeah, and in fact, that again was one of the question from that webinar chat, that what one should do, how one should do, and likewise. And I am very sure that eventually after a week series of webinar, one is ultimately in a position to have the answer from this IAP research webinar. So if one has preponderance towards developing a sort of outcome measure, there are various methodology in context to translation research, which is what is available, and people are trying to prove the statistical values in context to whether that is a valid and reliable tool so far as concerned with the particular outcome measure. So one may be in a position to do that sort of study. Second, many of us have a sort of time constraint, depend on the kind of uh, uh, program we are working for. That may be if we as a clinician, then we may have a single case study or case series, and likewise and ultimately able to have a sort of research design. We through IAP are in a position to collaborate amongst us across the nation, having a multi-center trial and doing the study. We can have a sort of treatment intervention, and randomized control trial is to be considered one of the best research design. If we would like to look for a prognostic study, so then prospective cohort study are going to be a sort of very much helpful. If we want to find out a sort of causal relationship, so where the association sort of study are going to be a greater help, a case control study are going to be a greater help, and as both the moderator as well as my fellow colleagues were mentioning, that we in physiotherapy have many of the thing which is being explained by the particular patient in context to the qualitative way. So when we are talking about the patient's experiences, it is also very much necessary that one can have a sort of qualitative research. Now, along with this, there is another method of mixed method study, where you have a sort of initial sort of cross-sectional study, where you are ultimately identifying the sort of problem, how much is what is existing so far as concerned with the particular region is concerned. Then you are identifying a particular outcome measures you want to modify to it in Indian context, or maybe translate it, validate it, reliability testing, and ultimately implementing for the particular population. So and you may even need to identifying by testifying that what is the experience your patient want to share. So which is a sort of mixed method study one may be in a position to apply. So there are various studies which one may be in a position to apply, and depend on what sort of clinical questions you want to address. Accordingly, you need to choose a best research design which is possible. Along with this, two things which are very much necessary and which I always believe are in need of. Number one is need for the particular study. Why you want to have that particular study? Not just for the replication of the study, or your XYZ study is being done so far as concerned with Western population, and now you want to do it for the Indian context. That's point one. which is necessary, and what in context to the literature search which is saying, and what gap have you identified through their literature search. If you are going to have this things as much strong as possible, ultimately when you are writing and putting your thesis for the presentation perspective, you will be in a position to answer two questions. Number one, why your research or study is significant, what is the significance of your research, and second important aspect, which is about the clinical implication of your research. By doing this research, how the change which is going to happen so far as concerned with the clinical practice is concerned. So this is how one is in a position to answer the question so far as concerned with the various research design.
Okay, so a problem when it's well stated, that means problem is half solved. Okay, yeah. So moving again forward to the Alpa ma'am. Ma'am, nowadays evidence-based practice, now it's become a little tricky when literature conflicts. So if two high quality studies show the opposite outcomes, like how should a practitioner, physiotherapist, clinician decide what to trust and implement? So do we really rely on context or patient factor or hierarchy of evidences?
Yes, ma'am. Not only clinician, but I would like to say the academician or our students are also having some query on which study do we have to rely or trust. When the two high quality studies show the conflicting results, a clinician should not simply choose one over the other. Instead, they must conduct a detailed comparative appraisal to understand why the results differ, evaluating the evidence in context of the specific patient being treated. Next slide, ma'am. So first of all, we have to critically appraise both the study internal validity. So risk of bias. So check for the methodological differences. Even high quality studies can have a limited randomization, blinding or attrition. So next is the sample characteristic. Always see the higher dropout rate in which study or non-compliance study in which study. Next is the data analysis, how the outcomes were measured, whether the outcomes are subjective or objective, or analyze intention to treat versus per protocol. So second point is assess the applicability. It is the internal validity, external validity. So in that, madam, next slide. Yes. In that patient population, first of all, we have to see regarding the age, comorbidities, severity of the disease, and baseline risk also. Next is the intervention details, where the dosage, duration, and timing of the treatments are differ or the same. Setting, whether the study was conducted in a specialized center or whether that study was conducted in a other community center. So next is the evaluate the broader context in which the evidence synthesis, recency and comprehensiveness. Select the most recent one with the most comprehensive research strategy. Look for consensus. Search for the other independent trials, systematic review and meta-analysis also. Understand the heterogeneity. One study might show the benefit in a specific subgroup, while the other study did not adequately analyze. The fourth point is utilize a shared decision making. Discuss with the patient. Explain the evidence is conflicting. The present the benefit and risk associated with both the sides of the argument. Incorporate patient value. Use the patient's preferences, lifestyle, goals to determine which outcome is more desirable to get a best result. So I would like to give one example. Next slide, ma'am. So that example is a shoulder impingement case. So suppose the scenario is like that, a 50-year-old patient present with a shoulder impingement. You are trying to decide between the manual therapy plus exercise approach and an exercise only approach. So what is the study A, which is a high quality study? It found that the supervised high load resistant exercise only is a superior to the manual therapy for the long term function. While study B, which is also high quality and finds that the manual therapy combined with the exercise, it leads to a faster pain reduction in the first 4 weeks. So now that's how to decide which study is better. So analyze the first of all patient. If the patient is highly distressed, immediate pain and wants a quick relief, then use the study B as a high quality research for your protocol. And if the patient is motivated, young, and has a long term functional goal and return to the sports activity, then study A is more relevant. Now, clinical expertise. You know that some patients cannot tolerate the high load exercise initial phase of their treatment because of severity of pain. You might choose a hybrid approach like manual therapy, that is a study B for the initial 2 weeks to reduce the pain, and then after next following 2 weeks you will add the high load exercise, that is a study A protocol. Now, what is a shared decision making? Okay, so clinician will think like that. There is the evidence that manual therapy helps in the short term for pain reduction, but the exercise are better for the long term result. So some studies say we need both. So what is your priority right now? Immediate pain relief, or you want a long term to fix that impingement? So what is your final decision? In that, clinician chooses the approach that aligns with the patient's immediate as well as long term goal while considering the safety and feasibility of the intervention. So this way we have to decide, we have to analyze the entire study, what outcome or what result we want during our treatment protocol. Initially pain relief we want, and then later on functional functional capacity also we have to improve in that particular patient. So at that time we have to choose a hybrid model, initially for pain relief and then later on exercise. So this way we have to decide clinically that particular protocol and review that article, what to choose, what not to choose according to our patient's need. Thank you, ma'am.
Thank you, ma'am. So it is somewhere a confusion between the activity and the evidence, activity with the evidence. So just we are treating patient. That doesn't mean we are generating any kind of knowledge. We need evidence for that, right, ma'am? Moving to the last part of this session, sir, there is something I strongly feel needs a clarity. That is, when we are working in our OPDs, clinics, and giving good patient outcomes, why it is not enough? Why must we still go through formal research? And is that clinical success alone is unreliable?
It is not unreliable in context to, I should say, but I would love and like to that because we all are from science. And as we all are from science, so what we have been taught since years and decades and centuries together from our rishis and ancient practitioners, that it is very much necessary that we should testify anything and everything that comes down to us. Here, even I just would like to quote unquote one of my mentor is it is very much necessary that every year we need to upgrade our whatsoever the capacity and interest we do have so far as concerned with the physiotherapy practice is concerned. And that is the reason why this sort of continuous professional education, faculty development program, and so on and so forth, things are necessary. So first is to rule out the false impression that X is better compared to Y just because of the cost effectiveness or the kind of look it has, the kind of things that has been said from the Western world, and likewise one need to understand and critically appraise it. Second important aspect is, as what madam also has mentioned, is try to minimize and reduce the bias as much as possible, and prove the efficiency and effectiveness of any therapeutic interventions scientifically. Scientifically, we mean by through analysis of the data critically, understand it, that whether it shows a sort of improvement for patients, but does it in real sense improve the patients or not, whether the similar sort of results, if we have applied as what in previous case madam has mentioned for shoulder case, will it be applicable to the other cases as well, or where the sort of hybrid measures are necessary, what sort of occupation one is looking for, what sort of comorbidities one may be targeting, and if you are ensuring that way, then you are better able to have the results. You also need to compare the results with the other forms of treatment. That may be a sort of the generalized treatment which is available to the newer interventions which are available. The outcome measures need to be measured accurately, so as it intends to measure what it is actually measuring, and ultimately to support what are the evidences of high values, and that's how this evidence-based practice is being supported.
So we have to treat, or we should treat research not as a requirement, but as a responsibility. Thank you, sir. Alpa ma'am, this is the last question for you. Like now there is one new word, innovation, we are hearing everywhere. I'm asking here that it is actually evolving rapidly. Is it necessary? At the same time, we are dealing with the human subjects. So my question is, what is the ethical line between the innovation and experimentation on patients?
Yes, ma'am. Drawing an ethical line between the innovation and experimentation requires ensuring that the pursuit of new ideas does not violate fundamental human rights. Next slide, ma'am. So there are certain key markers for drawing this line, which include first, informed consent and transparency, in which first is the awareness. Users must be informed that you are going to be a part of my study in next up to 2 weeks or 3 weeks or specific duration. Opt in and out, it providing a mechanism for users to participate voluntarily rather than manipulative or hidden tasting. Transparency, disclosing the experimental nature of feature or specific product. Second point is proportionality of risk and benefit, in which we have to minimize the harm effect and use the best available evidence. Third is the justice and equity. Avoid or exploitation. Experiments must not target a vulnerable groups, specifically children or low income users. If a patient is allotted in a specific experimental group, whether the patient is poor or rich, it is our moral responsibility to give each and every treatment in a specified dosage to both the specific patient. We cannot do a specific bias, whether this patient is from the VIP background, so I have to give a specific long time duration treatment to this patient, and low income patient or uneducated patient is not going to be not going to ask a question regarding my treatment. So let's wind up the session within a short time. So it is not like that. So fair distribution, risk and benefit should be distributed equitably. The fourth point, next slide, ma'am. Accountability and governance. So in that clear responsibility, there must be a clear definition who is responsible for monitoring, evaluating, and stopping the experiment if something goes wrong. So I would like to give an example, physiotherapy example, that is the exoskeletal training. Okay, So what is innovation? The therapist brings in a new developed rehabilitation, that is the exoskeletal design, to increase the walking capacity. Now, what is experimentation? The therapist uses the exoskeletal but instruct the patient to keep it on for next 8 hours straight, okay, without removing, far beyond the recommendation, to see if it causes the accelerated muscular change without clear ethical approval, monitoring for the adverse effect, or fully informing the patient of the high risk of the skin breakdown or unforeseen structural injuries. So, where to draw a line? Because in the initial part of the research, students and we all are so much excited. This is a new innovation, and let's try on our patient. So, without recommendation or without taking a ethical permission, we are giving that specific product or specific exoskeletal to our patient for the long duration. It may be harm or it may give a worsen effect. So where to draw a line? If the therapist uses the technology to help the patient with informed consent and carefully document the result, that is innovation. If the therapist is pushing the boundaries primarily only for their self benefits, that is a publication, publish that paper that I have done that very specific or very innovative that study. So that is not our motto. So using an unproven protocol without institutional review board approval, it has crossed into experimentation. So we have to choose or draw a specific line between the innovation and experimentation, so we cannot harm to our patient. So this way we can choose this specific protocol or specific that review board suggestion to save our patient and to publish our specific strategical article in our paper. So thank you so much, ma'am.
Thank you, ma'am. Thank you once again. I think that what clearly emerges here from today's session is that research is not just add-on on physiotherapy. It is a backbone that actually validates what we do. And if we continue to rely on tradition or personal experience, we risk stagnations. So on that note, I sincerely thank to Dr. Dhruv and Dr. Alpa for not just answering, but provoking us to think deeper. Now I would like to move to the audience and see if we have any questions from the participants. I believe both of our speakers has already covered so many questions, but still, if there is something new, let me find out.
Ma'am, likewise, one of the question is, the question is that whether the clinician running a clinic, can they perform research without IRB and publish? So that ethical approval, as what madam was mentioning, is very much necessary to get it, and one can have that approval from the ethics committee at any point in time.
Okay, sir. Thank you. Okay, there are questions like how to select the topic for research that you have covered. Case study occurs in individual patient, that also you have answered. There is nothing. Can you please? Okay, madam has also already answered here for the question. Can you please clarify the scoping review, literature review, and systematic review falls under which category? Can you please say the differences? If it is ethical approval. I think you just answered this question, right, sir? Okay. Anybody else want to ask any other questions? So we still have 2 minutes. Please write down.
Ma'am, for that systematic review,
Yes, sir.
we are going to conduct a next series regarding
Yes,
that FTP. So
yes,
I
request
every participant to be continue all these primary basic research series first, and then later on we are also planning to conduct that FTP on the systematic review also. So
yes,
through that you will get a clear idea about the entire research.
Yes, ma'am. Yes, sure. There is one question like, what kind of ethical problems that we may suffer? He or she wants the example from that. Anybody from you can give the answer.
Can you repeat the question again?
Ma'am, question is, could you please give us some examples for ethical problems that we may face?
Okay, if your study is not appropriate, the title will not include the appropriate format of that title, your methodology is not appropriate, or if that methodology during your procedure you may harm to your patient, then you will not get that ethical approval, because always patient is our first concern. So we have to take care before presenting our study in the ethical committee. What are the risk factors and how will you manage that risk during your study? So it is easy if you are managing all these aspects to getting clearance from the ethical committee. So Dhruv sir, would you like to add something?
As what Madam was mentioning, at the end, it is very much necessary that as a clinician or as an academician, as a researcher, ultimately, what we have taken as an oath is that we are not going to do any harm to any of the human beings. If we are not able to benefit them, that's fine. But if we are doing harm to them, that is to be considered as crime. So one need to take that point into consideration. Along with that, what sort of sampling method are you going to use? What sort of data are you going to collect? From where are you going to collect? She has also mentioned that if any sort of ill event happens, then how are you going to manage those ill event? Are you going to help in context to if any sort of ill event happens? Monetary benefits which you are going to give them in context to participate in your study, that should not happen. So there are a lot of things which eventually one is in a position to understand when you are going, and that's the reason why two aspects are necessary for any of the research. One is that scientific credibility of the particular research, which is looking for the aspect of the scientific feasibility of the particular study. And second is in regards to the institutional review board that will look after the ethical aspects where one is taking the point into consideration about the patient as human first, and rest of the things are to be considered later on. So that is how one need to understand it that way. There are few other questions, and I am very sure IAP as a research series are ultimately going to target within this particular week in context to, like, one of the question is that which study is the best, what is to be done in regards to doing systematic review or meta-analysis, which websites are to be referred, so on and so forth, and likewise. So I, as one of the member who are providing a sort of information, would love and like to convey it down over here that if you are going to be associated with IAPWC Kheda branch for this research series whole week, you are in a position to answer all the questions which are coming down to your mind ultimately.
Yes, sir.
Along with that, I am sharing my email. You can contact me personally in regards to the particular questions you want to target.
Yes, sir. Thank you very much, sir. The upcoming sessions from the IAPWC Kheda State team, hopefully you will be getting your answers for all your questions. And today's session, we talk about, like, today, if you have this session has made you slightly like uncomfortable about your current understanding of research, that is served our purpose, and we would love to see you again. And thank you being as a thoughtful audience for today. And I hope we should conclude this session for today's, and you can join us again tomorrow at the same time, 7 p.m. for the next session from our series as we continue this. So until that, stay engaged, keep learning, and keep questioning. Thank you once again to Alpa Madam, Dr. Dhruv sir, Dr. Shraddha Madam, Gopi Madam, and Nehal Madam, and our IIP team to start this initiative for our students, those who will be joining us in research soon. Thank you for this wonderful session again. Thank you.
Thank you, sir. Sir,
Thank
thank
you,
you
ma'am.
to the entire IAP KEDA team and IAP research team. And thank you again, all the